Robby, Robby, that's not okay. Nobody sent you home last year. Hello, welcome in. They call me Sour, and today we will be watching Season 2, Episode 10 of The Pitt. I had to take last week off from recording. It'll be like 3 weeks ago when you see this. But I had to take off last week from recording, and it feels like I haven't ever done this before. Miss one day, and I'm just lost. Okay, we're not going to do a big opener. We're not going to do a long talk about the last few episodes and how it made me feel and the things I'm excited for. I'm just going to say I'm excited. This is episode 10. This is when things start to ramp up if this season is following last season at all, which it seems to be for the most part. So, real quick, before we jump in, if you wouldn't mind taking a moment to hit like, subscribe, maybe the little bell so you get notifications when the next episode of my reaction to The Pitt is posted, as well as new TV shows, movies, and music, all kinds of fun that I will be adding to the channel over the next couple months. Now that my editing speed is starting to pick up a little bit and I'm feeling a little bit more comfortable with this whole thing. So let's go ahead and get started. Oh, do I have closed caption on? Do. Yes, I do.
What's up?
Slide broke at the water park. 2 victims, 5 minutes to touchdown. No information on extent of injuries.
I can jump in
Robby.
Oh,
Grab some goggles, gloves,
Really?
gown, go up to the roof. First patient that lands, bring him down. Hey, we got 2 choppers in here.
Robby.
Wanna grab some bodies and meet me?
What injuries are we expecting?
Structural collapse, could be anything.
oh goodness.
You will likely feel very drowsy. You may lose consciousness. And it could cause you to stop breathing altogether.
This is so hard.
I'll be right back.
That's really weird for Javadi. Has she lost someone to cancer that we don't know about?
Sorry. Look, it's hard seeing your patients die. But as professionals, we have to create emotional boundaries for ourselves. It's not about us, it's about them.
She's so calm.
Oh,
She had a long time to prepare for this moment. What she's doing for her sons, managing this with so much grace. The
seriously.
real gift of love.
I feel like an asshole.
Don't.
All they want is more time with their mother. All I want is less time with mine.
Don't feel guilty.
Don't.
I mean, you can be grateful and gracious from a distance. Just talk to her. Tell her what you want. She'll understand.
No, she won't. But
I doubt that.
everything we've
For a
seen
chance.
says she won't.
She may surprise you.
That would be great.
Hey, 2 birds headed our way. Need a hand?
That's the rumor. Santos, trauma incoming. Grab a gown. You can assist Dr. Langdon.
Oh. Okay. I have to. You know what that reminded me of? That reminded me of when a little kid gets told no by one parent and then goes and asks the other parent. I want to laugh, but I'm like so emotional that I can't. Langdon. I get it because I know he didn't ask. I'm being slightly like hyperbolic. Well, not hyperbolic. I'm slightly exaggerating, right? But to grab Ogilvy over Langdon, talk about a slap in the face. And then you went to Dr. Al. I get it. I'm not blaming him. It made me giggle. And Santos's reaction made complete sense. I want to say, I do have to go back and rewatch season 1. I have to rewatch, well, all of it, but there's a few episodes that people are like, please rewatch these, because with you knowing where Langdon ends up, you may have different feelings about Langdon and Santos. And I'm going to. It'll probably be after the season's over. But I want to be clear, I don't blame Santos for being uncomfortable, for not wanting to work with Langdon, for being nervous. I don't blame her at all. The issues I'm having are so much more with Robby and the higher ups not having like any plan in place for this. At least not from what we've seen. Now, I know Langdon wasn't supposed to come back that day, but still, I feel like legally there are some things that should have had to happen before they could work in the same environment. I guess my frustration with Santos is so much more of her just with this, right? I am so much more frustrated with Santos in the fact that she is having these reactions. See, that sounds so cruel. But I am upset with the way Santos is acting about Langdon in front of staff who don't know, like Joy, and patients. Otherwise, I genuinely do not care if she screams, F you right in his face. Do not care. Literally. It is about the patient experience. And by like Joy not knowing, I don't mean about Joy not knowing that Langdon stole medication from patients and that he went to rehab for like a year, it seems like. None of that. Joy can be told all of that. I don't care. I just find it inappropriate. And I guess my issue with her feeling threatened by Dr. Al earlier in the season, or that's how I'm reading it, and having to work with Langdon is in both cases, it really seems like she should go talk to Robby. Or if she's not comfortable talking to Robby about it because he and Langdon had such a relationship and now he's taking stuff out on Langdon, then higher up than Robby, which I guess would be like Gloria. I know Gloria's not there today, but you know what I mean.
Do cyber attacks happen often?
More than you realize. And the Roskies.
Dr. Mohan, it's your mother? She sounds pretty upset. She says she really needs to talk to you. You're shitting me. Tell her I'm not available.
Is she avoiding, I know why she's avoiding her, but I'm wondering, is something wrong with Mom?
Shift going. It's been a lot already.
Mm-hmm.
I worked in an ER before up in Vermont, and we had MBAs and ODs, MIs. But this place is relentless.
Holiday weekend. We're not normally offline.
I think we have a very different idea of normal.
Not for everyone.
I'm not sure it's healthy for anybody.
Here's your leg.
Oh,
Jesus.
yep.
Need more runners. Well, you could shut down the gift shop. They always have a couple of volunteers there. Most of those volunteers use walkers.
Beggars can't be choosers.
Go get them. I'm gonna grab a smoke first. No time. Nicotine gum. Take the edge off.
Oh.
Hang on, Moham.
What?
Sign this.
Nicotine patch, 21 milligrams. Who's it for?
Monica, this nicotine gum's shit. She'll never survive the shift, and I need her so I don't lose my goddamn mind. Thanks.
Is Dr. Abbott still around?
He went to get some sleep before his night shift starts in a couple hours.
Shit. Okay, I should have planned this better. I was hoping he'd write me a letter of rec for an elective so I could have a shot at a fellowship next year.
Oh.
Which one? Whichever will take me.
Did the elective fill up a while ago?
Don't remind me. I'm gonna throw myself at the mercy of the court, beg for them to take me anyway.
Oh, I feel for her.
What do you have?
Fall from 10 feet onto a metal fence. Right below the knee, good vitals.
Oh.
Oh, it hurts. My God.
What's she had so far?
50th vent, repeated 25. No meds, no allergies.
Where should I put this?
Just hang on to it for now.
Okay.
On my count? 1,
He's rocking
2,
it like
3.
it's a baby.
Okay, Whitaker, eat fast. Donnie, primary survey, please.
Pupils equal and reactive?
My leg hurts really bad. Did I break it?
I wouldn't say that it's broken exactly.
We're gonna
Don't
get an
say
x-ray to
anything.
determine that. Put that on the gurney, line it up for x-ray, keep your fucking mouth shut.
Yes, thank you.
Airway patent, breath sounds bilaterally.
Do not let him say anything.
BP 100/60, pulse 118, pulse ox 98%.
Oh, he's gonna lift it out and she's gonna see it.
Asshole, it's my leg!
Okay, she's really moving here. 100 ketamine?
Yeah, we can't evaluate like this.
Yeah. Don't pull it out so she can see.
Deep breaths, yeah?
Yeah, okay.
Whitaker, what's next?
Once she's sedated, finish the E-fast.
Don't
plain
let her
X-ray,
see
check her
it.
back straight to CT. Right. We should do a popliteal nerve block before the CT.
Oh,
Anesthetize
gosh.
from the knee down.
Hillview, tip fit, pushing ketamine now.
It's really interesting to see Whitaker so confident. Like, I appreciate how much his confidence has grown.
Stacking to 108, SAS 98 on 2 liters, BP 122 over 84.
Well, pan scan due to mechanism.
The fact that his first thought was, where's my son, makes me choke up a little bit.
Did they find my son?
Did you hit your head?
Don't think so. I need to find my son.
We'll find him for you, but we need to take care of you first.
Yeah, please let them.
Spleen looks good.
Start with this chest, that's where he hurts. No hemotemp in him.
Normal sliding.
Best to start with the side he's complaining about first.
I don't see much sliding there.
His name is Zach. He's 7.
Pneumothorax?
Set up for a chest tube.
Not yet. Let's go posterior lateral, look for fluid first.
Traumatic pneumothorax, we should prep the chest.
Not necessarily. He's hemodynamically stable.
Okay. Does that look like some fluid there?
Hard to say for sure.
Okay, he's tachycardic pneumothorax. He needs a chest tube.
BP and stats are fine. We can wait for CT.
Dr. Al, you gotta step in.
I agree. He's stable for now. Let's wait for the
Thank
scan,
you.
Dr. Santos.
Okay, let's order CT chest, abdomen, pelvis, and X-ray left hand.
See, this is where I get frustrated
Whoa,
with her.
major degloving.
Focus on the primary.
Dr. Langdon's correct. We need to log roll him.
Okay, how about another 4 morphine?
Put it in. Hang in there, Derek. We got you.
Please.
Fuck off already.
Boyfriend?
Wish.
Mom.
My mom. Every time I get a second of service, another dozen types.
Hey.
How much longer do I have to wait? I got a broken leg here.
Someone will be with you shortly, sir.
Am I allowed to use the bathroom? I really have to go.
I don't know, ma'am. I am not your doctor.
It says right there, doctor.
Yes, but I'm not your doctor. But if you go back to your room, a nurse will come find you.
I wasn't in a room. I had me parked in the hall.
Are either of you treating my mother? Nope.
Oh, she's about to break. She's gotta get out. Ooh.
Thank you.
Bee sting or muscle knot? Charlie horse.
I'm Dr. Mohan. This is student Dr. Kwan.
Kevin,
How long
She
has your
needed to
leg
go
been swollen now?
outside.
it's been getting worse over the past week.
Dr. Mohan, your mom called again. She said you don't
Not
need
now.
to call her back.
With a patient.
Can we not snap at Princess, please? Princess did not deserve that.
Have you ever had a blood clot before?
No.
She's not okay.
Are you all right?
No.
Do you need to sit down?
Oh no, I'm fine.
Yep, she's going down.
You don't want to, guide.
No, she's turning gray.
No, it's just and
You need to sit down.
I'm good.
No, you're not.
I need some air. Maybe excuse me 1 second.
This is not a sign of confidence for the waiting room. Let her out. She's gonna pass out.
Look out, make way.
Thank you.
Get in.
Thank you, Joy.
I'm okay.
You're not.
Get in the fucking chair.
I love Joy.
Please me. Coming through. Out of my way.
I'm sorry, but sometimes you just need someone like that.
I grabbed Zach's arm and I tried to hold on to the sides, but my hand slipped and my ring got stuck. My finger was ripping off and I lost him.
We can numb up your finger as soon as we gauge the extent of the injury.
You cut the damn thing off for all I care. I just need to find Zach.
Yeah.
Okay, do you feel anything here?
Yeah, sharp.
How about here?
Sharp again.
A little late for the show, yo-yo.
I am the show, Dr. Langdon. You're the warm-up act.
Think somebody missed me.
Hello, sir. I'm Dr. Garcia from the trauma service. Need the ring cutter.
That's why they pay the surgeons the big bucks.
Possible flexor tendon injury.
Try to bend up your ring finger.
No, thank you.
Let's go with the block.
I'm gonna feel a pinprick and some burning.
Which tendon did we test, Dr. Santos?
Seriously, that's a med student question. We're a teaching hospital. It's always good to review.
Thank you, Dr. Al.
Flexor digitorum superficialis is intact as it inserts on the middle phalanx.
Correct.
Gee, thanks.
No sign of tension.
That's what I mean. She is in front of a patient who has suffered a horrible trauma. She is in front of multiple coworkers. I need everyone to understand she is one of my favorite characters from season 1. And her cockiness is something I enjoy about her. It feels like her arrogance is causing her to become disinterested.
There's no tension in your mouth.
Garcia.
Help! Need a hand here?
My chest is so tight I can barely breathe.
Okay, I gotta get a swab lead. Perla, can I get an assist here?
Yeah, I'm on it.
I'm worried about her.
Why do we take down the tourniquet, Whitaker?
To give the residual limb blood flow. Two little pumpers.
A couple of figure eights, how to take care of those.
Park.
Okay.
Park the Shark, orthopedic surgeon.
Oh.
Is this a favorable amputation?
Pretty clean cut. Fence sliced through like a guillotine.
X-ray?
Now this patient is passed out, so
Just tying off a couple arterioles.
I'm not blind.
does he have some?
Where's the amputated leg?
Double bagged on ice.
Sterile
He's one
saline
of
on the inner
those.
bag, ice water in the outer bag, no direct ice on skin contact.
One of those
Spent a lot of
surgeons.
time.
He still needs to look.
I do not understand why every single orthopedic surgeon I have ever met, and I have met a lot, are cocky assholes. I'm like, yes, you are working on a very important part of the body. Truthfully, the entire body is very important. But excuse me? You're not a brain surgeon. You're not a heart surgeon. Why are you this cocky?
Get Robby.
She's having a panic attack, or is she sick?
I'll book an OR. Irrigate the hell out of this with 3 liters.
3 liters?
Of saline, genius.
Do they have a personal issue, or what?
I knew he meant saline.
Yeah.
Dr. Robby, we need you in Central 6. Dr. Mohan may be having a heart attack.
What?
Yeah.
EKG is normal.
Yeah, you're having a panic attack, honey.
What's going on?
It's okay. I'm okay.
You don't look okay.
No.
You look like shit.
I feel like shit.
What happened?
I don't know. I just got really hot and I started having trouble breathing.
Any chance you're pregnant?
Not sure I feel comfortable answering that. No.
She was tacky, but it's resolved now. Have you eaten anything?
Yeah?
You staying hydrated?
100%. I'm doing everything right. It's everything around me that's all fucked up. It's just my mom moving and calling me over and over again, and now me scrambling to find a job next year. I had it all planned out, and now everything's just out the window.
Wait a minute. Is this a panic attack because of your mommy issues?
What? No.
Robbie.
Do you need to go home? You should go home.
No, I'm fine.
I don't need the fucking liability. Go home.
Robbie.
And the rest of you, last time I checked, the ED is a shit show, so let's all get back to work.
That's not okay. Nobody sent you home last year.
I brought some drink options.
Okay.
We've got apple juice, cranberry juice, OJ, and Pittsburgh's finest.
What's that?
Oh, water.
Water.
OJ, please.
I'm really mad at Robbie.
Now, I am going to give you 2 pills. You want to take both pills for 3 days and drink lots of water. I'll write it all down.
I hate pills.
I know.
Could you mash those up and put them in the OJ for me?
Coming right up.
Mel's gonna be super worried when you tell her.
You are going to be just fine. But as far as telling your sister what's going on with you, that is your decision, not mine.
So you're not gonna tell Mel?
No, he can't.
I can't. Not unless you, my patient, tell me to.
Do you know when Mel's gonna be done with her important meeting?
Hopefully soon.
Mankind—she's just a butthead sometimes.
Yeah, brothers can be.
He's your brother. And he loves you.
Don't go.
I don't wanna go. But it's not up to me. Okay? We'll always be connected. No matter what. Invisible string.
Invisible string.
I've been cutting this case from most of the episodes, or really, really paring it down. It was really hard to edit. And I thought it was hard to edit just because I don't find myself talking a lot during those scenes. But now I'm wondering if I have been doing that because these are hard to watch. Sometimes things affect us and we don't make the connection as to why. What wisdom is McKay gonna offer?
Hey. You gonna go in and see your mom?
Cancer sucks.
Yeah.
Yeah. Yeah, it does.
It's not fair.
No.
No, it's not.
You should get to grow up.
I don't want to go in there.
Not going in there won't make it stop.
Nobody's gonna make you. But if you don't go in there and say goodbye and tell your mom you love her,
it's gonna be so hard.
I think you might wish you had for a very long time.
You only get one shot at this, bud.
Ketamine's wearing off.
Don't let her look.
Kill my leg.
I'm Dr. Michael Rabinovich. You're at a hospital, and we gave you a nerve block so that you can't feel any pain. You were on a water slide that collapsed and did serious injury to your leg.
Don't let,
Is that my leg? Is that my, did you cut my fucking leg
She's
off?
Your leg
no.
was cut off in the accident. Our surgeons are gonna try for replantation.
No.
She needs more ketamine.
Strap up the leg. Emily, I know that this is really hard. I need you to focus on me right
Yeah.
now because we need to get your consent to proceed with the surgery.
Can you just put it back on?
That's what they're...
Can you just put it back on?
Sounds like consent to me.
Now, could she have sedation?
Okay, load her up. Ketamine and rock. It's gonna be okay.
Yeah.
It's gonna be okay.
Can that be saved?
The finger or the ring?
The wedding ring.
Yes, sir. A jeweler can weld it back together good as new. Well, stop.
Not if it's tungsten.
Irrigate the ring shavings off first.
What did I miss? Finishing irrigation. It doesn't look like you lost any skin.
It's a little dusky. Might not be viable.
There's intact skin on the dorsum. More irrigation, then tack it down with one suture.
Okay, thanks. Radiologist reports a 25% pneumothorax.
Is that bad?
That is a partially collapsed lung that needs treatment.
I can put in a chest tube.
He doesn't need a chest tube.
Okay, what do you want? A pigtail catheter?
I was thinking a Thor event.
What? Why? It's not a bad idea. No need for well suction.
If Hannah can operate today, you can go home tomorrow with a Thor event.
You can learn a lot from your senior residents.
I'm happy to teach Dr. Santos.
Yeah.
Thank you, Dr. Langdon.
She's gonna snap. She's literally going to snap.
Who the fuck did this? No sign up on orders for labs or x-rays, and it's in the wrong freaking rack. You guys trying to kill me and the patient?
I'll take care of it.
Thanks.
Dana, this gum is
Shit, I know.
Pharmacy said you needed this right away.
Just in time. Slap one on and give it an hour to kick in. You're welcome. What?
The prescription is for you.
My insurance will cover it. Hers won't.
Is that insurance fraud?
Throw me in jail. I could use a vacation.
Javadi.
Mom,
There's a lot of mom stuff this season.
I'm really glad to see you, Mom. I
Garcia told me about the sigmoid volvulus you missed.
It was an oversight.
That could have killed her.
Just without electronic records, it's been kind of a challenge to figure out.
Chaos is the status quo in the ED, even when the computers are working properly. You have to be hyper vigilant and double check everything.
I can handle.
Is it really appropriate to be scolding her right now?
Here you're learning street level medicine, all seat of your pants. Oh, well, I made a mistake, but the more talented practitioners upstairs will fix it. You are better than this.
That's
Love you.
disgusting.
Well, that is one way to do a debrief.
You should talk to her.
Which one?
Honestly, both of them.
Yeah.
Can you call in some extra doctors?
Sure. Everyone's dying to work on the 4th of July. Why?
Dr. Mohan went down.
Yeah. I saw your pep talk.
Yeah.
She's taking a little break until her labs are back. She's going to be fine, but I'm not sure her head is in the game.
I'm on it, Cap.
One of my biggest issues is people being hypocrites. I have really big issues with hypocritical people, and right now I am furious at Robby for treating her that way. That was disgusting. And I expect a lot better of him. I'm so mad.
She's gonna stab me.
It's just a medical term.
Stay superior to the rib.
Is there a problem?
Nope. Everything's going well.
Place the trocar. Pull back the adhesive wings. And advance until you see the red diaphragm move. That means you're in the pleural space. Okay. Now we can either hook up to wall suction, or we can use this one-way valve to repeatedly aspirate with a syringe.
Now, with all your vast experience, Dr. Langdon, you should probably decide.
We can avoid wall suction if I pump manually.
Have at it, Doc.
Enough.
Thank you.
Apparently decency and decorum need to be reintroduced to our R2 curriculum. Nice work, Dr. Langdon. We'll go check on an OR for Mr. Foster.
Again, I understand her anger, her upset, her fear, anything that could be attributed to what happened last season. But she can't, if the patients are noticing, it's not about respecting Langdon, it's about respecting the profession and the patients. And that's what I'm annoyed by.
Oh, for fuck's sake! Go! Quickly, before I change my mind.
Hey, did the county pick up Louis' body yet?
No, he's still in the viewing room.
Jesus, he's just laying there?
Yeah, another couple minutes and I'll wheel him down to the morgue myself. What's the bullet? 8-year-old boy, part of the water park accident, thrown off the water side.
How far did he fall?
Maybe 6 or 7 feet, landed in a tree, had to wait for a ladder truck to get him down.
Major neck trauma, must have taken all the impact there.
Couldn't tube him, hard to bag, stats in the 80s, BP 85 over 60, pulse 50.
Okay, 1, 2, and 3. Possible laryngeal fracture.
Hypoxic bradycardic.
Kidneys and airway before your wrist.
Bronzo tape, Peds cart, set up suction.
Oh my God. Is that Zach?
Please close the curtain.
No response, no purposeful movement to pain.
Oh my God.
Is this your kid?
No.
Sir, go back to your room now.
Bronzo says 25 kilograms.
Jesse?
5.5 ET2.
Okay, 30 of rock, 50 can be.
You're paralyzed?
Yep.
If we can't intubate, we crack.
He's too young for a crake.
Better with cricoid pressure?
Nothing.
Okay, towel roll between the shoulder
Heart
blades.
rate down to 49, headed to cardiac arrest. The trache's gonna take 20 minutes. This kid's not gonna last 60 seconds.
That's why we're doing a slash trach.
Don't know it.
Me neither. Boss?
Show me what you got.
Pull up the trachea between your thumb and middle finger. Vertical incision.
This is hard for her.
Vertical, not horizontal, or you transect the trachea and cut the jugular veins.
It's a lot of blood.
Now it's a tactile procedure.
Great minds, Whitaker.
Incision through the tracheal rings. Finger in the trachea. Bougie into the airway. Thoughts on what's next, Dr. Whitaker?
Insert the ET tube into the trachea.
I feel like she's done that way more times than she wants to have. Although I suppose one is too many times.
Okay, bag him. Check the CO2.
Sounds coming up in the 80s.
Yay!
And tidal CO2 is 70. That's crazy high.
It'll come down. Tie down the tube, control all the bleeders. Spray an epivapi on a stack of 4x4s.
Okay. Good. CO2's in the 50s. Good heart rate.
You forgot the last step. Change your underwear.
How many of these have you done?
First one.
You serious? What about you?
None.
I practiced in the sim lab when I was at Stanford.
What'd I miss?
All the fun.
Slash trach.
Seriously? Fractured larynx, couldn't oxygenate, couldn't ventilate.
Use a meat cleaver on this kid?
ENT can revise the trach in the OR.
She's had...
We'll be thrilled to clean up your mess.
Or maybe they'll thank us for not letting him die.
Yeah, she has a lot of emotions going on. They all do. Oh my God, you're killing me. You're kidding me.
Thank you.
That actor.
What brings you in today?
Friend made me come in. Name's Robby. He said I should...
Ah, you're Duke. Donnie.
Yep.
Robby's VIP is here.
Wow, it's weird to see that actor. I just wasn't expecting it.
Hi, I'm Donnie, nurse practitioner. Robby's already put in orders for a numbing spray for your nostril.
Nostril, it's my throat. It's not my nose.
Okay, let's get you set up in a room.
Literally has VIP treatment.
That was the most unprofessional deposition I've ever witnessed. They were nowhere near that aggressive with Dr. Ellis.
Okay.
She's going in to shut down.
It didn't go as badly as you think.
They suggested I was incompetent.
They're posturing to set the stage for a ridiculous settlement request. This isn't about those parents or that kid. It's only about trying to make a lot of money.
Well, I don't have a lot of money.
No, it's not you, hon.
It's an insurance game. You're protected by the hospital. This won't affect your career.
She really needs to go melt down.
Okay. How's Becca?
Oh, she's fine.
Yeah? Okay, I should go see her then.
How was your deposition? I'm sure it was stressful.
What's going on with Becca? What's her diagnosis?
Well, I can't tell you.
Why?
HIPAA.
Seriously?
If you want to know what's going on with Becky, you're going to have to ask her yourself.
Yeah.
Can I get the county coroner's number?
Well, what?
I just want to make sure if no family shows up, Louis gets a proper burial.
It's expensive. You may want to run it by the missus first.
Maybe I started GoFundMe. I bet people around here would pitch in.
Hey, kid. You can't do this for every in-house guy that dies around here.
There, but for the grace of God.
No, the success of your sobriety is a testament to your support system. Louis didn't have that.
Still, Louis is a good man. He deserves to be put to rest with dignity.
I'll dig it up.
I agree.
About fucking time. If I knew you were gonna make me wear a dress, I wouldn't have come at all.
Dennis Whitaker, meet my buddy Duke.
Nice to meet you. Any friend of Dr. Robby's? Friend of mine?
Friend is a vast overstatement. He's more just a pain in my ass.
Don't let his surly exterior fool you. Deep down inside, he's just as grumpy.
How did you two meet?
Tinder.
Duke is a motorcycle engineer.
You should have seen his Bonneville when he first brought it in 6 months ago. Someone left it for dead.
He helped me bring it back to life. Today, we're going to return the favor. Dr. Whitaker is one of our most trusted physicians, and today he's going to help me oversee your care.
His look.
Ask him. He's the one who made me come in.
He's had some hoarseness on and off for a couple months.
Okay, any history of tobacco or alcohol use?
Yes.
Two of my oldest and closest friends.
Former 2-pack-a-day smoker and lover of the drink.
Okay, he on any medication?
Blood pressure meds.
Which he forgets to take.
He's all numbed up and ready to go.
Okay, thank you, Donnie. My man, I'm going to take this scope and I'm going to stick it in your nose and we're going to check out your upper airway.
Seems like a lot of fuss for a sore throat.
Dr. Whitaker, you want to explain to Duke why this procedure is absolutely necessary?
The scope is going to give us a better view of your voice box and your vocal cords.
Here we go.
Yeah.
Blech. Uncomfortable.
All the way out, good. Now say E.
E.
Good. Now again, say E. Good. Removing the scope.
That's such a cool image.
Dr. Whitaker, what do you think?
Looks normal, no abnormalities.
Told you it was nothing.
Yeah, with your history of smoking, I'd like to do a chest x-ray. If there are growths, they can push against the recurrent laryngeal nerve intermittently. That can paralyze one of the vocal cords and cause the hoarseness.
That sounds like a lot of bullshit doctors speak to charge me more.
You've got Medicare. Besides, I finally got you into my ED. You're going to get the golden workup before I leave town tonight.
Only an idiot would ride all night after working a 12-hour day.
That does sound pretty dangerous.
You stay put or do I have to tie you down?
Fine, so long as you keep your hands where I can see them.
No promises.
Is Dr. Robby just flirty with everyone? Like, literally. Unless you're a patient.
Hey. Are we okay?
Nope.
Yeah. Why? I don't know. You kind of ripped me a new one in front of Langdon. Whose side are you on?
This isn't middle school. Langdon made a mistake and owned up to it. Let it go.
He should have been fired. But instead he waltzes back in here, no big deal. Meanwhile, I've been a goddamn pariah for the last 10 months for doing the right thing.
Or maybe you're a pariah because you don't play well with others.
Yeah.
If you've still got beef with Langdon, go tell him. He's here to stay, so put on your big girl panties and work it out.
No.
You want to have sex and eat ramen in bed, I'm your girl. But if you want to talk about this Langdon shit, again, call a therapist.
Yes. Thank you, Garcia. That clarified a few things for me.
How's it hanging, Dr. J?
Never call me that again.
It was a joke.
Relax. He's clueless about your TikToks. But you're not.
Of course Joy's not.
Props in the side hustle. There is no hustle. There's some stupid videos.
Wait, are you an influencer?
No. Yep. Yo, pre-docs! It's not happy hour yet. There's still a shit ton of patients to be seen.
Ben, our /trade kid from the water park, had some purposeful movement in pre-op.
That's a good sign. Take the win.
We need to talk.
Oh?
We are talking.
In private.
Okay. Is she gonna say something about Santos, or let's not?
What the hell was that with Samara earlier?
Oh, thank you.
That was tough love.
That was not.
You are her superior. She was obviously struggling, and your advice was go home?
Essentially, yeah. This is the ED. It's not for the faint of heart.
It's not for the unempathetic either.
Samira's not having a panic attack because of her patient. She's having one because of personal baggage. What she needs to do is pull her head out of her ass and focus on the work.
What about you? What do you need to get some basic human empathy back?
I don't know. Something that gives me a little hope this place won't fall to shit when I'm gone.
Round two. The Waterside Dad's kid?
I cannot believe this. At the beginning of the season, I would literally be flabbergasted that I am saying this, but I'm 100% on Dr. Al's side. Robby is being a fucking asshole. Yeah, I'm 100% on Dr. Al's side. Because how dare he? This season is really putting to the test how I feel about my favorite characters. I think the only character whose opinion I have not yet changed on, at least some degree, is Dr. Abbott. And we got him for what, like a total of 10 minutes screen time so far? How do you all feel about ranking videos? Because I think that may be something we do. Because, like, my opinions from season 1 to this, man, which means it's good TV. Please understand, I am happy that the show is making me feel different things for the same people. That is good. That is good writing. That is good TV.
How'd you manage that?
I went outside, stalked the dad's IG, found a pic of his son, sent it to Pittsburgh PD. Now they're on the way over.
Well, maybe Gen Z should be working for the FBI.
Hi, Becca.
Mel.
Hi. You doing all right?
I'm a little bored.
Yeah.
How are you feeling?
A lot better. Dr. Langdon gave me some medicine and OJ. He's super nice. I see why you like him.
Did he tell you what the medicine was for?
Yes.
Yep.
Did you tell her?
I did not.
No.
I explained to Becca that due to doctor-patient confidentiality, everything she told me was private, and that it was her decision if she wanted to share anything with you or not.
Good.
Do you want to share?
Yes.
Thank you for asking for consent, Mel.
I have a urinary tract infection.
Okay.
Oh. Okay. Yeah, those can happen if you hold your pee in for too long or you accidentally wipe from back to
Mel,
front.
I know, Mel. He told me.
Oh, good.
Yeah.
He also told me it can happen from having sex.
Yeah, it can. It's not like you're having sex.
Yes, I am.
What?
I'm having sex.
Good for you, Becca.
With who?
My boyfriend.
You have a boyfriend?
Yes. His name is Adam, and we're having sex. Lots of sex.
Good. As long as you're being safe.
Mel, are you okay?
No. She's struggling.
Got a sec?
Sure.
How you feeling?
I'm fine.
Yep.
You sure?
Yeah. Troponin, D-dimer, and TSH all normal.
You close that door.
Listen, I'm sorry about earlier. I think I was being...
A dick?
I was going to say unprofessional, but probably that too. I'm sorry.
Thanks.
But now I kind of need you to stop feeling sorry for yourself and focus back on your patients. Think you can do that?
Sure.
Great.
I'm still not happy with him.
With this extra dose and increased morphine from the pump, your pain should subside. Your breathing will slow down. You may get very sleepy.
I'll go be with the boys. They need you more than I do now.
Later. Right now, I'm exactly where I'm supposed to be.
Great.
Okay, here we go.
I personally wish the boys were there. So that was a really hard episode. In a lot of ways, that was a really hard episode. So the Santos and Langdon thing, right? It actually steered me back, that conversation between Santos and Garcia. That actually steered me back to my original point of view. And apparently it's not a very popular point of view. I'm saying that because a few of the comments on episode 8, I believe it was episode 8, talked about things from Santos's point of view and encouraged me to kind of understand where she was coming from. And I agree in that I think it's really important to understand where everyone is coming from. The problem is now I do understand where she's coming from, and I'm back to this is really unprofessional of her. She is not acting like a doctor or like an adult. If she has a problem with him being there, then she should take it up with the higher-ups. That she is acting incredibly inappropriate in front of patients to the point where that patient noticed. He is dealing with finger being degloved, air in the chest cavity, worrying about his son, and Santos is being snarky right in front of him to Langdon, is impacting his care, and that pisses me off. You don't do that. It wasn't appropriate, and it wasn't okay. And it has been building all season. So her conversation with Garcia just reinforced for me how I felt pretty much the whole season. And Robby talking that way to Dr. Mohan, I am very upset with him. It was uncalled for. It was being a dick. It was unprofessional, rude, insensitive, not appropriate for a boss. He talked about Dr. Mohan needing to get her head out of her ass. He needs to. He is being incredibly inappropriate, and I am disgusted by his hypocrisy. I'm mad at the two of them. And I want people to understand, I didn't like Langdon season 1. I thought Mel liking him was kind of ridiculous. There was like very, very little redeeming qualities about Langdon to me during season 1. I'm not a Langdon fangirl or anything like that. I feel like he's made mistakes this season, but comparing those to Robby or Santos, there's no comparison. I was genuinely shocked by the actor playing Robby's friend, or his VIP, just because I am currently watching along with another channel who is reacting to The Walking Dead. And if you know, you know, his character in The Walking Dead, he barely looks like he's aged. He just has lost weight. But it was good to see him. I do really enjoy that actor. Like, I really enjoy him. So it's nice that he's doing a little guest spot on here. And Joy, again, is a joy. She makes me so happy. I enjoy her so much. She is smart, sarcastic, dry, empathetic, commanding. I really like Joy. And I hope that we get to see more of her next season. I have heard I'm trying to stay away so badly from any news about the show or anything like that because I am so far behind. And realistically, I'm going to stay that way. Like, I would love to watch episode 11 right now, but it's not going to happen. So I know there are some casting things I've seen about season 3, but I've seen nothing in regards to Joy. And I hope that she does come back. I really, really do. Now, with all that said, although I may sound and feel aggravated and a little annoyed, I have enjoyed our time together today. I hope you have as well. If you did and you haven't already, I would really appreciate if you hit the like, the subscribe, maybe even the little bell to get notified when the next episode of my reaction to The Pitt Season 2, Episode 11 airs. And if you are on mobile, please, hype. Do the little hype thing. It is YouTube's new device for algorithmic push, so I would appreciate it. It also helps me as I try to grow this little channel of mine. All of that I would greatly appreciate it, on top of you being here. Thank you so much, and I hope you have a wonderful day. Bye.